Our first question is on health reform. It goes to Mr. Dalton first. Recent reforms have removed barriers to affordable insurance coverage that many chronic disease patients and survivors faced in the past, eliminating annual and lifetime limits, guaranteeing coverage to people with pre-existing conditions. All are vital to people who have or have had cancer, asthma, COPD, and other health conditions. How would you protect the health of chronic disease patients by ensuring that affordable health insurance coverage is available to them? Danny?
Well, I definitely agree with a lot of parts within the...
Mike?
Hello? Hello? Here we go. Yeah, I'm the only thing I don't really agree with the Affordable Health Care Plan the way it is right now is the mandate. I thought the mandate was unconstitutional. But actually the mandate was forced there from major lobby groups, okay? And I think one of the big problems with our reform in a lot of different areas, not just healthcare, but also with Wall Street reform and other areas within our government, is that our two parties are being coerced and out of fear don't directly resolve the problems that need to be resolved in our reform efforts. As far as the access to affordable health care for those kind of problems, what I wanted to see was a public option for health insurance provided by the government in competition with the private insurers, but that was kicked out by the special interests and big lobby groups such as U.S. Chamber of Commerce, who is backing certain party members, not to be mentioned here in this state, not here right now. But there's also another option, which is the single payer system, but I think the public option is the way to go, first of all, because it allows you to compete with the private health insurance providers first, and then maybe go towards a single payer effort. So for me, I think what we need to do as a country is to make sure that we're being represented by our representatives, and our representatives aren't representing special interests and big money and major lobby groups like pharma who undermine some of our Affordable Care Act provisions, who basically is helping to stop generic drugs from coming into the country by providing pay for delay and aspects like that. So I think that's all I can talk to that.
Thank you, Jenny. Cynthia? You want me to repeat the question, or you say?
I think I can remember the question. Thanks for the opportunity to be here today. It's a pleasure. My name is Cynthia Dill. I'm the Democratic nominee for the United States Senate, and I'm proudly the only candidate in the race, I believe, who not only supports the Affordable Care Act, but believes that we actually have to move towards a single-payer system. And as Maine's next United States Senator, I will do everything I can to move in that direction. I'm really proud of the work that President Obama and the Democrats in the Congress did to get the Affordable Care Act passed. It was obviously quite a challenge and subject to incredible partisan bickering, but at the end of the day, it's passed, and we're seeing positive results right now. Children can stay on their policies until they're 26. There is no cap on insurance. Women are no longer considered a pre-existing condition. There's reductions in the cost of prescription drugs for seniors. Women and families are now able to get preventative health screenings, including mammograms. All these things are good. They will reduce the cost of health care over time and improve the quality and health outcomes for families, which in the long run is good for communities, which is good for the economy, and which is good for the world. I believe that in addition to the Affordable Care Act and moving towards a single-payer system, what we have to do is protect and strengthen the social safety net. We have to make sure that the next Congress doesn't balance the budget on the backs of social insurance programs such as Social Security, Medicare, in addition, Medicaid. I think this is a really important topic, especially for Maine, because we do live in a state where we have the oldest population, and in particular, when it comes to women, Social Security is incredibly important. Women tend to live a little bit longer. They are subject to health complications later in life that demand higher levels of service. They also pay less into the system because of blatant discrimination when it comes to pay, but also because women tend to take years out of employment to raise children. All those factors create a real necessity for Social Security to be secure, and Simpson-Bowles has been suggested as some way to balance the budget, but I just want to warn people that the Simpson-Bowles agreement does cut Social Security benefits and place arbitrary caps on Medicare. So in addition to all of those things, I'm the champion for good health. Thanks.
Andrew.
I've got 2 mics. You shouldn't give me one, not much less 2. I believe you are a cancer survivor as well, sir? But yes, I'm a cancer survivor. Not only will the 6th of November be election day, it will also mark 5 years clear of cancer. And hopefully it will be the last time we have to talk about it, because my long-suffering wife saw me through it. First of all, I want to say that it's a shame that some people running in this race are running away from the healthy subjects and the important subjects like healthcare and how we take care of our fellow Americans. It disgusts me, and I'm sorry as an ex-Republican that he behaves in such a manner. I'm not a fan of the AFA, partly because I have lots of relatives on my wife's side and friends who are dealing with things like the National Health Service, which is in fact where many Democrats want this country to head. There is a wonderful line by, I believe, P.J. O'Rourke: you think healthcare is expensive now, just wait till it's free. And you have bureaucrats making decisions on people's lives. We know of relatives and friends, parents, who didn't get the care they needed because some bureaucrat thought it wouldn't be valuable expenditure of tight public funds to pay for someone over 75 to get the care they need, and would rather give it to someone who has a long life, and may I say, a tax-paying life ahead of them. Now, socialized medicine is not the panacea it's made out to be. I think we need to allow access across state lines for buying insurance, like auto insurance. That's another line that Charlie Summers has still stolen from me, by the way. And I think it's ultimately, we need reform, but a 4,000-page document, most of the politicians who vote on it didn't even bother to read, is not the reform that we need.
Thank you, Andrew. I almost said Governor King again, because I covered this guy for 8 years. I said Governor. Angus, you're next.
When I heard you were the moderator, you know, that was a difficult decision, sure. Maybe that's what drove Charlie away. I support the Affordable Care Act. I supported it before it was passed. I support it now. I would fight to keep it. I would not vote to repeal it. And I got a letter just last night from a young man who's helping me up in Penobscot County putting signs up. And it really it covers exactly what we're talking about. He says, I'm a 23-year-old college graduate who's still searching for a full-time job. I'm also unlucky enough to have been born with a tumor in my head that was discovered about 6 years ago. While I'm lucky that it's non-cancerous, it still requires yearly MRIs and other tests to make sure it doesn't grow. Because of the Affordable Care Act, I've been able to stay on my father's insurance while looking for work and can afford to have these tests done. I can also sleep comfortably knowing that I can no longer be denied coverage because of my pre-existing condition. To me, that just says the whole thing. That's why I support the Act. It's not perfect, and we're going to have to work with the implementation. Implementation is often very important, and it doesn't deal necessarily very effectively with issues of cost, and I hope we're going to have a chance to talk about that today. But it does talk about access, and it's already having an effect in Maine. It's already benefiting people in Maine, whether it's people who aren't having to pay the extra charges for their drugs because of the closing of the donut hole, whether it's because of people with pre-existing conditions, preventative payments. All of those things are in place right now. And I think it would be a disaster if it was repealed because we'd be set back another 15 years. Who knows when a president and a Congress would be willing to take this on again, given what we had to go through to get this passed. So I support the Act and would fight very strongly to maintain it. I think there are other things that we need to talk about as next steps. But as far as the issues you mentioned, Mal, I support the Affordable Care Act and am proud to do so.
Steve.
Thank you. I'd like to take a few seconds introducing myself before answering the question. I was asked a few questions from even members of my table over there, table 8. I am not Angus King's bodyguard. Although I'm here and able to protect him. I'm not a politician by trade, nature, or personal interest. I am the chairman of the Yarmouth Town Council. I'm the CEO, owner of TideSmart Global. I own and run one of the largest preventative care diagnostic health and wellness companies called Pro-America Health that some of you may have heard, based here. I'm on the board of Big Brothers Big Sisters, and I'm joining the board of Boys and Girls Clubs the next few weeks. 2 weeks ago, I was named as a healthcare hero by Harvard Pilgrim. I'm also on the Maine Health Management Coalition as a CEO champion. And I ask you one quick favor as I begin, that please, after today's meeting, don't mention that I was here to anyone from the Portland Press Herald. We have a silent agreement. It's kind of a witness protection thing. The Portland Press Herald, they have worked so hard over the last 6 months to maintain my anonymity. But I really don't want to jeopardize it at this point. And without piling on in a kind of gratuitous way in terms of Secretary of State Summers, the 5 candidates before you today were also last week at Maine's Women's Health Coalition debate, which took place at University of Southern Maine. And just as today, late in the game, Secretary of State Summers pulled out, and as I said then, as I believe is relevant now, I don't look at it as a strategic decision, and I'm not a big fan of hyperbole, but I really thought it was political cowardice. And I think for the important issues that we're facing, both as a candidate and as one of the constitutional officers of Maine, for Secretary of State Summers not to come here today, I think is despicable. I also support the ADA, and I support it from a perspective where it's not perfect, but as Governor King said, there's been decades where this has been discussed. And I look at it as not only a healthcare imperative, it's a moral imperative. And the mandate that we're facing is who we are as a people, who we are as Americans in the United States, to take care of people from prenatal to hospice to elder care in all types of disease states. So I appreciate being invited here today, and remember, no mentioning to the Portland Press Herald. Thank you.